Hello guys, today I want to talk about CT scans of the head. I will use the images from Radiopedia, which is a great free resource for learning images. So the first question I encounter a lot from medical students is how to know if the image is a CT scan or an MRI of the brain. It's very simple. CT looks ugly and MRI of the brain looks just beautiful. You can see all those details. You can see the gyri, you can see the border between gray matter and white matter really clear. In CT, we have three planes, the axial, we have sagittal and coronal planes. The coronal, you can just remember, it's like a crown. The way you put the crown on the head, it's the similar way you do the coronal cut. So CT is all about density. So the structures and lesions on CT is hyper, hypo, or isodense. So now I will scroll through these axial views and we can name some structures together. So the cuts here starts at the base of the skull and we are scrolling up. As you can see, the bone is looking very white, so it's very hyperdense. These are the eyeballs, so this is the front of the head, this is posterior part, this is the right side and the left side. As you can see, this is the brain stem, and if you pay attention, you are able to see a structure here, which is the basilar artery. Sometimes you can't see it. So these are the brain hemispheres. At the back, we have the cerebellum. Here you have the frontal lobe, you have the temporal lobe, you have the insula, Sylvian fissure, and this is the occipital lobe, parietal lobe. And then as I scroll up, you can see the lateral ventricles, the anterior horns of lateral ventricles, and the posterior horns. If you scroll down, you can see the third ventricle, and you can see the fourth ventricle right here. Remember, always scroll all the way to the top. Now, if you pay attention, you can see all of these details. These are the gyri, and it's hard to see when you're a beginner, but as your eye will used to it, you can see the border between the white and gray matter as well. Here you can see the caudate, thalamus, and internal capsule is right here. Now let's take a look at the coronal view. This is your coronal view. So if we start from the front of the head and go backwards, here you can see the eye globes, the sinuses, the frontal sinuses, and then as we go back, this is the frontal lobe, You can see the temporal, medial temporal area, and the temporal lobe here. You can start seeing the lateral ventricles. This is the third ventricle. And then you see the fourth ventricle, and this is the brainstem. This is the occipital lobe right here, and you can see the cerebellum right underneath occipital lobe, especially here. This is your cerebellum. Now let's take a look at the sagittal view. So this started at the midline. So this is the anterior part of the head. This is posterior. These are the sinuses, the black areas you can see, which we call it hypodense. And here you can see vermis. You can see the pons and medulla, midbrain, cerebellum, occipital lobe, parietal lobe, temporal lobe, and frontal lobe. Alright, these were all about a normal CT scan. Please put in comments if you had any questions. In the next videos, we can talk about the abnormal CAT scans of the head. Thank you.